Hi there, and welcome to the Future Makers podcast by MAND. This is where we talk to people from scientific and high-tech organizations with a purpose. I'm Angina Herman, and Avelo is hiding under the hood to make sure everything runs. Say hi to everyone, Ave.
Hello.
And today we get to speak with Melanie Aregger, co-founder and CEO of Avelo, a company that develops breath aerosol collectors for diagnostic purposes. Welcome, Melanie.
Hi, everyone. Nice to be here.
So, tell us, Melanie, why does Avelo exist?
So the short answer is to have impact and saving lives, but there is also a bit a longer answer, and the longer answer is actually the reason why we started the company, or the story behind how we started the company. My co-founder and I, we know each other now more than 10 years. Back then, we already tried to do something in the diagnostics field for tuberculosis. And it didn't work out, so we parted ways, but always stayed in touch and said eventually one day we will try this again, because we are both impact driven, and wanted to do something meaningful. And it took the pandemic, actually, so in our case it was a good thing for once. And we came together, did some brainstorming again, and we did systematically screen so-called target product profiles, TPPs. And one from the World Health Organization mentioned that there is an urgent medical need for non-invasive sampling, especially replacing sputum samples, also within the context of tuberculosis, but even more for lower respiratory tract infections. And we said, this sounds exciting. And it was on a Saturday, and then Monday morning, Toby texted me on WhatsApp and said he just quit his job. And I said, okay, wow. Oh, wow, exactly. And I said, okay, if he jumps, I'm going to follow, and jumped as well. And we founded the company because we both said, okay, the pandemic showed us life is too short, and we both want to do something, and we felt the time is now to do this.
Okay, impressive. So tell us a bit more. So what exactly is this product? I mean, to a casual observer, it sounds essentially like a breath analyzer, like the kind of thing that anybody who's driving a car has sometimes had to use when a cop stops them and tells them to blow into. But I'm sure this is not the same thing, or not quite as simple as that. So what is it that you're developing?
So the breath collection device we are developing is a device you can imagine like the blood tube or urine container. It's a collection device, which in our case works with breath. So you as a patient, or if you have an infection, you would blow into this collection device. And then it has a smart mechanism that makes it compatible with the existing PCR tests. So in our case, we really focus only on the collection part, and then we make it compatible, or this is something we need to show and prove, that it is compatible with the existing PCR tests and with the workflows. And the reason is that in the pandemic, we saw there is a lot of PCR testing done, there is a lot of infrastructure now existing, and we want to tap on that existing infrastructure. And the innovation we do, we cannot be the next PCR test, but we can solve an issue on the collection side, which is still there. And that's why we focus on that part. So in that sense, it is like when you do the alcohol thing, you blow into something, in our case, the tube, but then the testing is done by the platforms that exist.
Mm-hmm. Okay. So what's the innovation here? What are you doing differently now?
So the innovation.
Or what was missing before?
So breath, in the generic answer is breath as such does not yet exist for breath aerosol collection for the detection of lower respiratory tract infections. And so establishing breath as a new sample to better diagnose these infections, that's kind of the generic thing. And specifically in our case and our technology, we have a smart way of, on the one hand, in the short amount of time, you breathe into the device to capture, if you're sick, any kind of pathogens that are in your respiratory tract, but then also make sure that we can get it off that collection device and put it, simply speaking, put it into a PCR test and make it detectable. So we have kind of both mechanisms and technology that allows us to do that.
So it's like a combination of scientific innovation and operations to just make the workflow.
Yes.
Good. All right. So why has this not existed before? So why have there not been too many breath analyzing tests for these diseases?
So breath as such, and we also see that's one of the key challenges we face is, yes, we do know from COVID there were some super spreaders, but more let's say, in general, you could say it's quite hard to capture in the short amount of time. Yes, if you would have a patient blow into for hours and hours, eventually you could detect something. But in the short amount of time that you would capture sufficient pathogens that you can actually detect them. So it's still quite a challenge, and we see that also in our proof of concept studies. We saw that every patient, every lung, everything is different, and to come up with a device that can do the sampling in a standardized way, that's really challenging. And the technology to do that now with PCR being much better, you can detect very, very low amounts of pathogens. That certainly helps. Then our filter material is a nanofiber filter material, so that also helps. So there are some technological advancements, I would say, we tap on, which now hopefully make this possible. So we are still in the development mode. We need to prove that whatever I say now is actually true, but that's the vision.
Okay, to me, this is starting to sound a bit like those dogs that we know that can smell different diseases on people. I wonder if it's the same kind of molecules, the same kind of mechanisms that we're approaching here. Then
it's a very good question, because it's actually, if you then go technically into more details, you would see. In our case, the dogs, usually what they smell are the so-called volatile organic compounds. That's kind of the reaction of your body to a certain disease. But in our case, what we do, so there are many so-called VOC companies or several VOC companies who do that. That's kind of one approach. But in our case, what we try to do is capture the actual virus or bacteria in your breath. So not the reaction of your body to the disease, but the actual disease-causing pathogen. That's what we try to capture. So we have there a different approach.
Okay, so on the end of the operations, do you have some collaborations going on, like with the PCR testers, or how easy or difficult is it to develop that side of the business?
I would say it's going to be the make or break case, because just collecting something without then doing the analysis is not going to help anyone. So we cannot fulfill our mission and reason to exist. And we have been working, and from the beginning when we started the development, with existing platforms, you can buy them, and also with partners. And we started to approach them, and we did find several that were very open and said they find breath as an ideal specimen. They see this and have supported us from the beginning. So we do work with several partners, and hopefully in the future with even more. And because without them, the solution is not complete, so to speak. But it's not easy, obviously, as a small startup, to convince the big players to work with you.
So no names yet that you can drop?
No names yet. Hopefully soon, hopefully soon.
Good. So what's your target market? So are you developing this mainly for Switzerland, Europe, like the developed world? Because to me it sounds like this could be an ideal solution eventually for like developing countries, because this is so fast and simple if you get everything running. But what's your plan for the future?
It's actually the reason why Toby and I started. He has a background in tuberculosis, and we came from this angle, and this target product profile I mentioned at the beginning is coming from that space. But our target market, let's say we focus more on the disease. So we would, right now we have two, the tuberculosis still, and then the so-called lower respiratory tract infections. they cause pneumonia. So that's kind of the disease we all know. And when you look at who gets it mostly, so tuberculosis is definitely a global south topic and problem and challenge. And pneumonia is mainly in children and the elderly. I mean, also adults can get it, but most severe, it's in children and the elderly. And when it comes to so that's kind of the key population we would focus on. And on the market side, since we want to join and partner up or have to actually to make this whole thing work with PCR platform partners, ideally, we get the partners that have a global install base that are present in many, many countries. So from the geographic point of view, it would depend of with whom we partner. And if that's kind of a dream probably of every startup that you can go global. And we would want to do that in collaboration with these partners, not by ourselves, but really with their existing sales and marketing setup.
Yeah, also to make this work, I mean, I imagine it needs to be very widely distributed to make it worthwhile for you to be able to pay salaries for your employees, and because it's not going to be an expensive, I mean, the global south is not going to be able to afford your solution if it's super expensive and you need fancy insurances for that. So you need to have volume.
And for us, and that's kind of, the idea is in the global south, we cannot ask for a high price. That's for sure. On the other hand, what you can get in the global south is volume, because there are many, many. So a volume would help us to reduce our production costs, because it's, simply speaking, it's a piece of plastic in that. Obviously, it's much more than that, but simply speaking, and the more we can produce, the lower the costs will get. So maybe in the global south, we don't get a high margin, or maybe not even a margin at all. But with the volumes, it would help us to reduce the costs, and we can make the case then more in the global north, where we can then earn the money. That's something that obviously our investors and we also want to see. We want to have a business that stands on its own.
So what is the team currently? How many people are you, and what kind of expertise do you have?
We have 7 people by now, and are now in the midst of recruiting or hiring another 2. Expertise so far is mainly science and engineering. So we have mainly an R&D team, and myself, I have business experience, operations experience, and a little bit more, as you both know. And what we are looking for is really now also on the quality management side, on the business and clinical medical expertise. That's something that we now need to or want to bring into the team. And marketing.
That's the yeah, exactly. I'm wondering, like, what's if it's the relationships with the platforms, with the testers, that is the make or break, then what kind of expertise do you need for that?
So it's really the key business development expertise, and also part with clinical know-how, medical know-how, that when you talk to these partners, because ultimately, still, yes, the patient also decides, but it's together with the doctor, and the doctor will say, let's do this analysis, let's take a breath test and see what's going on, what makes you sick. And so we need someone that can help us convince the clinical KOLs and also the PCR players. So you need to be in this healthcare space, need to talk their language, and it's a bit a mix of clinical, medical, and science that we need the business person, or let's say a person with business acumen, to have. So quite a challenging try to get everything into one position.
So you have investors backing you, or what?
Yes.
What's the funding structure right now?
Yeah. So we did a seed round. No, it's not last year. It's actually 2 years, in 2022. Time is running quickly. Time is running quickly. And we also have now non-dilutive research grants. For example, we just got a large InnoSwiss project, and from this InnoSwiss Startup Innovation tool, the new mechanism that InnoSwiss has put in place, and also Eurostars project, for example. And we also can participate in a Horizon project. So in that sense, on this non-dilutive side, we also get financial support. But usually it takes both. So at least in our case, it takes both. It takes investors and those research grants. And we did at the beginning put in everything Toby and I had on our bank account. We put it in.
So you really do believe in this, huh?
Yeah, we said there is no backup plan. There is just this one plan, whatever it takes.
Impressive. I've been asking a lot of questions. I think I should give Ave some time to jump in as well. Otherwise, she won't get to say anything if I don't pause for a while.
Oh, good. Thanks so much. Lovely hearing the dedication and everything you're talking about, Melanie. And if I understand or remember correctly, because we did work together, you don't have a background in like biotech or anything. You have a business background. Right. And
Yes.
I love seeing business people who want to do good for the world. So where does your need to do good things come from?
Good question. Where does it come from? I mean, when I was, my parents, they used to run a hotel. And when I was 8 years old, I stood in front of my mom. I put on her business clothes and told her, Mom, I want to become an entrepreneur one day. And she was kind of laughing and said, yeah, girl, you have no idea what this means. And eventually, so kind of the drive to do something and have my own business or start my business. And I'm lucky to have such a great co-founder to do something together. This has been there, probably DNA from my parents. But then something in healthcare, it kind of, when I did my business administration studies, I had interest in so many different industries and I didn't know what to do. So what did I do? I joined consulting because you don't need to choose if you join consulting in the first place. And I did get to see different industries and I could still not decide. And then I happened to get an offer for a healthcare company. And then I realized healthcare is kind of, wow, that's where you can really do something. And I guess from that, then it started to develop and I kind of pursued my path in healthcare, life science, diagnostics. And then it came about and it's something that has been inspiring me. If I can somehow help and contribute to saving lives, then I should try and do my best to contribute to that.
Interesting question. I'm thinking about the phrasing from you, Ave, that I don't know, I'm not sure how you meant it. Like, you don't have a science background, yet you want to make the world a better place. How come? We've actually had quite a lot of business people recently. That's become like a theme. Like, you were a fancy consultant earning big bucks, and then you went and did something to change the world. How come? But that actually seems to be quite common. So I feel like, okay, maybe it says more about the kind of circles where Ave and I hang out.
I think so too.
Yeah, because the business people we meet seem to have
Yes.
actually quite a lot of purpose behind
But
what
we
they do
also
with their
search
education.
for them. Yeah, we make an effort
Okay,
to
fair
look
enough,
for people
fair
who
enough.
want to do good things.
And to me, the beauty is, in the end, it really, the nice part, at least in our case, is Toby has the science and technology and engineering background, and I do the business. And I think it's very valuable to have these complementary skills, not only in terms of having the skills to do that, but also in terms of how you think, because you do think differently usually, and that kind of helps also to see challenges and tackle challenges from different perspectives. So ultimately, we do share the same mission and want to achieve the same with the impact and this doing something good, but we have different expertise and ways of looking at these things, which is also quite helpful. So I hope for you get to interview kind of all sorts of people with different backgrounds, because ultimately that's what makes it work if you have different perspectives.
I think also when you're running a business together with someone, it immediately helps you divide the departments what you take care of, because you know very clearly know that you have expertise in this and the other person has expertise in this.
Yes. Yeah. So it's funny, it was never a discussion although the title, so to me, it's the title was never important, because the one aspect of the title was important to me. The co-founder aspect was important to me, but the CEO versus something else wasn't that crucial to me. The co-founder was crucial, but then it was immediately clear between me and Toby who would take on which title, because it's just obvious, right? So
Yeah.
I'm still somehow stuck with this idea of different purposes, because I realized from this juxtaposition of business versus science, because I originally studied physics until I jumped into philosophy, because I realized I would make a terrible physicist because I couldn't deal with calculations. There was too many numbers and too many equations for me. And my motivation to study physics was not to change the world. It was more like I want to understand how the world is, like the non-changing world, the laws of nature, apart from the messy human side of it, because people just come and make everything worse. So I just wanted to make a clear separation between myself and the society. And which is, I'd say, pretty much the opposite of making the world a better place, or at least, being very removed from any kind of social conscience. And that came only later. And the more I've started feeling responsibility for the human society and for what humans do on the earth, that's also when the business aspects and a lot of the non-scientific aspects actually come to play. So I don't know.
but sometimes it's helpful to have such a perspective like you do, right? To take a step back, to try to understand before jumping into conclusions too quickly. And it could even be helpful for a team to sometimes slow down before you then pick up and run again, right? So I think it also has quite a lot of advantages of taking on such a position, and it doesn't necessarily mean that you would not contribute to making the world a better place. I think quite the opposite, because if you think about that, certain leaders in certain countries would rather take a step back and think about some things first. Could be maybe a good thing to do.
Yeah, but maybe they don't get elected next time then if they take the pause. So what has been challenging, Melanie, yet? So what's been the hardest in this business so far, or has it just been fun and relaxing joy times all the time?
So the generic answer, and then I will be more specific, the generic answer is it's usually always challenging, and there are a few highlights which give you so much energy that you continue through all the challenging times. So it's been challenging from day one. And it started with something I did not expect at all. I mean, I did expect finding money and developing a product and solving this very, as I told you in the beginning, the whole thing about how to capture sufficient pathogens and all these things. But at the beginning, we were simply looking for a lab, and we could not find one. And I was so surprised, and I was like, what? This is the first challenge. We don't even start it, and already to get started. And we found, so then Toby at the beginning was in Basel in a shared lab. That was really, really nice, in an innovation hub. He could be there. And then eventually here now in Schlieren, close to Zurich, we found a lab, and it all turned out great. But this kind of, that you are full of energy, you want to do all these things, and then you stumble across the first kind of little thing you did not expect. So that was a tough one. And then along the way, some of the key challenges is finding investors. I did, for example, or we did over 160 or even 170 pitches. And on the technical side, I guess Toby could tell you how the things and all the challenges we and now our R&D team is facing on developing this product, on making it work. We did some proof of concept clinical studies with patients together already. One in South Africa, they had many stories about how things were there and how they were different to what we did here and all these things. But eventually what helped, I would say in all cases, is kind of the persistency and just trying to go through it, stand up again and just continue. Just continue and believe that some way you find a solution, some way it's gonna work out in one way or another. And don't stop to believe that if you just want it enough, that somehow you find a way. That's kind of how we overcame all these more or less big or smaller challenges.
I love that you brought out that you did 150, 160 pitches, because usually what you see about companies is just that they secured this round of funding and this round of funding, and it feels like you just go and pitch and you get funding. So you're bringing out that no, it's like, I don't know, 1%, 0.5% of the times when you get funding, and how much work there actually goes on behind it is such a crucial element of entrepreneurship, I think.
And it's really funny. Eventually, you cannot hear yourself anymore pitching, because you are telling the same story over and over, and you always want to sound with, all your passion and your energy, and you feel like, can I switch up the story a little bit just to make it interesting for myself again? So,
yeah.
So did you ever switch, or was it 150 times the same pitch?
Fortunately, it was not the same pitch, because at the beginning, like the classic startups, we actually pitched the whole breath test, the whole thing. And then we realized the innovation is more in the collection part and not in the testing part. So we had to completely redo how we think the business case and the whole thing. So we did change a bit. And eventually, once you have more substance, you did a clinical study or something like this, you can add this to the pitch as you grow and do the things. So, but the overall pitch, after we made the big change to focus on the collection, that overall pitch has kind of stayed the same. And I hope all the investors that have been hearing us so far, or did hear me several times, they don't get bored.
Well, at least you're consistent. I mean, on the one hand, it's good that you learn, you make the changes when you see that something's changing in the world. But on the other hand, if the core of it is your vision, is what you're actually passionate about, then I think it's good that you can stay true to it. So I wonder, with this persistency, I mean, that's what you hear a lot from successful entrepreneurs, is that you have to just continue doing it and not get discouraged by these 150 no's. I wonder how much of, like, you come from an entrepreneurial family. I guess it's a kind of spark that you've always had. I myself, yesterday I was talking to an old study colleague of mine who's been an entrepreneur, like, before he was already 18. I think he was running little side business all through studies, and he was the guy who was networking and now he's doing a lot of sparring and consulting for other entrepreneurs, and he was giving me some tips, because I am completely new in this field. I've now been an entrepreneur, a full-time entrepreneur, for like 2-3 months, and I'm wondering, like, is it too late in my 40s to jump here? Is it something that I should have been practicing all my life? Or, like, I don't know, I'm still a little on the fence of it. I love it so far, but I haven't yet built my empire, and I don't know if I ever will. But do you feel that you've been this person always, or have you learned something about entrepreneurship?
I think a little bit of wanting to do it has been in me since birth and came from my parents, but then doing it and is so I did, as I shared with you, when I was 8, and then always wanted to be an entrepreneur, but I kind of never had the right idea, or then did not have the courage. And it actually took my husband. He has, with his brother, his own company, and he was always pushing me and said, now jump, do it, trust yourself, do it. And I was like, no, and then maybe, and then I don't have a good idea. And again, it was then Toby actually who did the jump, and I followed him, and I'm very glad to have these people around me that helped me to take this jump, because they either pushed me or they jumped first and I could follow. And in that sense, no, I did not have that in me, but it's something I wanted to have. And then it took really a good my good people around you that support you in this and tell you, yes, you are doing the right thing. Because you oftentimes, maybe you have this yourself, Angina, that you think, is it a good decision or not? Can I do this or not? What happens if I fail? And all these thoughts, if you have people around you that support you no matter what, that's kind of very helpful to go through these moments of doubts and then try to fight. And the fighting part I can, that's something I know, but just, all the other things that takes with it, to be that entrepreneur and stand up again and try again. I think that's a lot coming also from, if you get like me, having the luck to have such a great network around me. That's quite helpful.
You have some sports background as well, don't you? I guess it's a bit of a same mentality there. Just continue until you can taste blood.
Yeah, kind of. I've always been, kind of sports fanatic. When I was little, I could never sit still, and I always wanted to move and do stuff. And now, the easiest sport I can do, or what I do, is running, and that's certainly something, where I'm also ambitious there. And then you fight and have some hard trainings, and that helps you to build up this resilience and try to fight for it. But some people tell me, use it as a hobby and not. You don't need to fight everywhere.
Wonderful. Then let's go into the tough and the question that we will return to 10 years later to see who was right and who was wrong. So 10 years from now, Melanie, what will the world look like?
If all goes well and whatever I just now say, what we want to do, we actually do and walk our talk, then to me it will be fantastic if you're a patient, you have a acute respiratory infection, and you say, let's take an Avelo collect and let's find out what makes me sick, and I want to know how I can treat my infection so I get well again very soon. That would be kind of my dream scenario.
Very good. Heading towards that one then.
Great.
All right. Thank you very much, Melanie. It was a pleasure to have you here.
Thank you both for all the great questions and for bearing with me.
It is no trouble whatsoever. I think we're the ones to bear. All right. Ave, should I do my outro now or should I save it for later?
Do it now, please.
I shall do it now. Let's say we don't even edit this little speech in between to give people some background info on exactly how we do this podcast. So here comes the outro that you must have heard before already because you're regular listeners by now. If you like hearing stories from people who make the world a better place through science and technology, you're in luck because there's more. So make sure to subscribe to the Future Makers podcast, for example, on Spotify. Until next time.